All right, welcome back. It's still Breakfast Daily, and we have a hashtag Breakfast Daily. If you're watching us on social media, we do want to hear from you. So kindly, when you send your comments on the stream, kindly add the hashtag Breakfast Daily. Also, the WhatsApp line is 0550-585832. Now, we're going to get in some community-focused conversations, and today we're going to a place called Kolpong, and the residents there lack primary health care facilities, and we have a report for you. Let's take a look at this report. We'll come back and then we'll delve into some conversations.
The Kolpong community has over 2,000 inhabitants, majority of whom are farmers. Residents in the community are confronted with enormous development challenges, though the area is referred to as the food basket of the Wa East district. Roads leading to the town are in deplorable state, making it extremely difficult for farmers to cart their farm produce to market centers. This CHIPS compound serves as the major health facility not only for the inhabitants of Kolpong, but for 8 other communities with an estimated population of 16,000. The residents say accessing health care at this facility is increasingly becoming a nightmare as the facility is inundated on a daily basis with patients. It is a Monday afternoon, and some of these patients who traveled for 15 kilometers to access healthcare services at this facility say they have been queuing for over 6 hours to have their turns to receive treatment. The residents say the situation is having a toll on them and want the government to address it.
Timbicha to Kobayala Bama Terminal to Baha, Emon Koma Kenyabon, Kanyan Biara, Kivaduga Anna Korea Canada, a sort of Mamba Masuma, Mambandun Grasora, Antibunki, Yan Ladoana.
Kinanka Kolpong Jing to Tare, Tora Jama, Chat Tora Yal Faraman the Bama, Unala, to Jagata Lanfilo Yala, so Lanfilo Yala that Yatora, a Kuti Kolpong Jing. Kinanka Chang to the Batar Asabre, to the Antar Asabu Korean and Changulua. Ojawa leting so anwuluka pambana kanya nanya chobo ati Kolpong jenga bo kinanka Kolpong jenga tenkwanla Kolpong yompu na kinanka tembili agile Kolpong cha ajama okone ka wo ispalon Kolpong ye jenga kan au ka tenkwanla abi to wo ispalon so kinanka ayalanga kanya nanya chobo aye erenga se ka iga ada changa bi bulinge bi kiloga cha anu logo bi jihi ko garagbawa so anwuluka Lanfilo yala to da ya musaka to akuti jenga jagaja
tora nam fora to pawache te bibiri lanfilo yala ibie man biara inde wache ko kun tomo ka gara wa gara bulinga aza ye tora akuti ko man doran ni watache ko kun tomo ka gara wa ka gara bulinga ka kanga banta tara ka fega ka biye wabata baba tona ka biye kwi.
The plight of residents of the Kolpong community adds up to the already dire healthcare delivery situation in the Wa East district, as dozens of communities are facing a similar situation. With over 93,000 population, the Wa East has no district hospital or a doctor, except the district director of health services, who doubles as the only doctor in the district.
The district has been operating for over 14 years now without a district hospital, even though we have the Agenda 11 hospital in the district capital, but we do not know when this will be completed. So until then, we would ask for support in order to put up at least a basic theater with theater facilities so that we'll be able to avert these referrals that move all the way to Wa Municipal and the regional hospital amidst the bad roads that we have. Not only are we faced with infrastructural challenges like the theater, but we are also faced with inadequate critical staffs. Critical staffs in the sense that we do not have adequate doctors, physician assistants, laboratory technicians, pharmacists. As I speak now, I am the only medical doctor serving the over 93,000 population. So you can imagine the strain on me. I do administrative work as well, and so I do not have full time to concentrate on the over 93,000 population. And the physician assistants to are not there. Currently, we have just one physician assistant in the district. So that is a very, very big challenge.
He says there is an urgent need for doctors and other specialists to be sent to the district, as the few who were posted have all refused to work in the area.
So even though we are asking for infrastructure and other logistics, but we are also challenged with the needed staff, mainly because most people refuse posting to this enclave because of the deprived nature of the district. For those who the region manages to convince to come, when they set in here, within 3 months, they are asking to leave again. And that has put a strain on the few critical staffs that we have within the district.
To help improve good quality care in the Wa East district, Qatar Charity Ghana, a non-governmental organization in collaboration with the Office of the Member of Parliament for Wa East constituency, constructed and commissioned this facility to aid the delivery of quality healthcare services for residents of Kolpong and adjoining communities.
We are aware that the health needs of this area are so critical and so paramount. The reason being, we only have a health facility that is a referral center in Bulunge, serving all the Chakali area. The next available one is the local health center. For all the 16 or so communities here, often have to be referred down to Logo. This puts a lot of pressure and stress. Consequently, the health authorities informed me will be recording a lot of mortality rates in this area. That's how come I decided to approach Qatar Charity to complain to them that this is what our people were going through and if they could be of help. Fortunately, Qatar Charity responded.
Director of Qatar Charity Ghana, speaking at the commissioning ceremony, extended his gratitude to the chiefs and people of Kolpong and its neighboring communities and thanked them for their cooperation and warm reception. He promised to provide the facility with a borehole as soon as possible for the smooth running of the facility.
We are grateful for the warm reception, for the good translation of partnership between government, community, parliament, and NGOs. This is a real good example of cooperation between all the partners, either officials and the community. I thank you all for being here, and I thank you all for what you provided to help us.
Right, so that was a report from Kolpong, talking about the state of their healthcare delivery. Now we have on the line our Upper West Regional correspondent, Latif Mahama. Thank you very much and welcome to Breakfast Daily, Latif.
Thank you so much, Rima, and good morning to all our viewers.
Right, now we saw an institution from Qatar come in to provide a health post. Should this not solve the problem?
Thank you once again. The issue in White East is very dire. If you ask me to answer your question straightforward, I think that the new facility that was commissioned on Saturday is only the beginning of the solving of the situation, because the facility, though it's been commissioned, the requisite personnel that will man the Kolpong facility are not there. And so, as you heard the doctor speaking, the right personnel who are supposed to man the facility are not there, because when they put critical staff, nurses and other health workers to that area, they don't accept postings. And so it's one thing commissioning the facility and another making it operational. Remember, there are such issues even at the Upper West Regional Hospital, where you have some sections of it that are not operational because of the lack of critical or the needed staff to man the facility. And so, if you want to ask me as to whether the commissioning of the facility comes to solve the problem, I think that the problem is not yet solved.
Right. So
it was only commissioned and the personnel are not there.
Okay, so let's understand the situation properly. What exactly is hampering the delivery of quality healthcare? Is it infrastructure issue? Is it personnel? What exactly is the problem?
This area is one of the deprived areas in the Upper West region. Fortunately or unfortunately, the area is regarded as the food basket of the Upper West region. If you go there, that's where you get farmers of almost all farm produce. But then, road network, if I must say, is the major hindrance to healthcare delivery in the West East. The few SIP compounds that are located in the area, anytime there's a referral, they are not able to do that with speed because the roads linking to the communities are in a very, very deplorable state. And so, one, the right personnel or facilities are not there to deliver health service at the community level. Two, when they are referred to where they can get the needed healthcare service, they are unable to go because of bad roads. Another issue is the issue of infrastructure. If you go to the West East, you can have more than 10, 15 communities that are sharing just a SIP compound. And as you know, SIP compounds are just offering primary care health services. And so people have to travel from the hinterlands where they are farming, and sometimes, especially in the Kolpong area, you have more than 16,000 populations that are dependent on just a SIP compound with just 2 nurses. And so, giving the right healthcare delivery at that level is being hindered. And when they also refer persons or patients from the areas to WA, the road is in a very, very, very deplorable state. Even on a 4-wheel drive, a journey that can take you just about 30 minutes from WA, the regional capital, you need not less than 3 hours to get to Kolpong. And so, roads are a major hindrance when it comes to healthcare delivery in WA. Coupled with that is the issue of lack of the requisite health personnel to deliver health services in the area. People don't agree to be posted to the area. The few that are posted they go and in 2 weeks time they find other places to go. This is the only area in the Upper West region that has no district hospital. A whole district, they don't have a hospital. A whole district, they have only one doctor, and that doctor also doubles as the district health director. So he has to merge his administrative work with his job as the only doctor. So this is the situation in why the few health facilities that are there are under-resourced, and even nurses and other critical staff that are supposed to deliver health services are not there. They don't have even an operating theater. So when somebody is pregnant, you are carried from probably your community to the nearest health center. But even where to get operated in the entire district, they just don't have an operating theater. So you have to travel from Banchala, you are from Kolpong, those areas, and you are pregnant and you need to be operated. You need to travel for about 4 hours to the regional capital, which is the nearest.
Right.
Before you can be operated or receive attention from healthcare workers.
Right. So let's look at this new commissioned health facility. What does it come with? Is it fully furnished to start operations as long as we have personnel coming in? And who, if you are privy to the details of engagement, who is supposed to bring in the personnel? Is it the Qatar people? You know, sometimes there are hospitals that the people decide that we are going to manage ourselves. Are they looking at giving us doctors and nurses? Are they just presenting the facility and then leave it to maybe the health ministry, Ghana Health Service to now post people there? What are the arrangements like?
The commissioning of the facility at Kolpong, I must say, is a major intervention as far as health delivery is concerned in the area. But the major issue that is of a problem is the health staff that will manage. If you look at it, Qatar Charity Foundation in Ghana, they heard the plight of residents in that area, and so they decided to build that facility. And the facility comes well with other equipment and beds, well-furnished facility. It's a well-furnished facility, and that was handed over to the community, and the community in turn handed it over to the Ghana Health Service. And I'm happy that the Regional Director of Health Services, Dr. Daniel Pumure, was at that ceremony, and he received the facility. The community as well as the MP for the area made a passionate call that the Ghana Health Service should go through the needed processes and post personnel to the facility so that it will not be a white elephant. The concern basically is that they must get people to go and work at the facility.
Right. Thank you very much, Lateef. Thank you.
Thank you.
So that is the situation. Now the hospital has been built.
Yeah.
Fully equipped.
Yeah.
We are waiting for human beings to come and operate this thing.
Yeah. I think that, Lateef made some interesting points at the very beginning. He was talking about the fact that people get posted and then they don't stay, right? Sometimes you get posted and people they just refuse to go, Those kind of situations. I think that it's important for us looking at the broader conversation of the way we run our healthcare system, that anybody who has been to, let's say, SMS in Kolebu, School of Medical Sciences, or Kolebu, in Accra, for the duration that you've been in, if you are being posted outside, or even nursing training or whatever you've been to, you shouldn't feel disadvantaged in any way, all right? Because we all sat in class together. We all went through the training together. If I'm being posted to, say, Wa, or in this case, in the Wa East District, Kolpong, I shouldn't feel disadvantaged. It shouldn't be like a transfer to Wa East is almost like a curse or a problem.
But why shouldn't it feel so?
It shouldn't feel so. You see, whenever you do a system that is functioning properly, there should be perks and privileges that are built into the system so that when somebody is being posted to WA, that's why, for example, when you're working in an organization like the UN, right, there are zones that you go to, they say they are not family zones because of the high risk, right? But they compensate you by giving you perks and other things. So people actually choose to go to such places. That's what I'm talking about.
Okay, now
we have to build a system that people will even say, you know what, I want to go to WA for 3 years because I know that I will benefit.
Of course, and for me, sometimes, you can't just base the argument on people's emotions and pleading on people's
you can't do that.
Benevolence. You can't do that because you can't sit in Accra and tell people that go to a place where you can't even drive your cars on good roads, you can't have access to... It can't happen, So we have to also put certain things in place, especially when people have the option of choosing something else. I can decide to go into private business, private sector, work for a private company, live right here in Accra. So sometimes these are the challenges. And really, you can't blame the people who are posted and decide not to go.
Yeah, it's true. We want to talk to the Member of Parliament for Wa East, the Wa East District Director, Dr. Godfred Seidu Jasso. Dr. Godfred Seidu, good morning.
Hello, good morning.
Yes, good morning. Welcome to Breakfast Daily.
Yeah, thank you very much. Let me say I'm Dr. Pascal Kingsley Min.
Dr. Kingsley Pascal.
District Health Director.
Yes. Welcome to Breakfast Daily. Now, just give us a sort of a sense of the capacity of this facility that has been put up within your district and the kind of breakthrough or intervention that it's going to bring to the district.
Thank you very much for having me on Citi. Let me just briefly give you an insight to the district before I respond to your question. So the West district is one of the 11 districts in the Upper West region. It is the most deprived district in the region in terms of healthcare, roads, and also other amenities. We serve a total population of a little over 93,000 people. And then in terms of health staff, we are the district with inadequate health staff in the region. Now, the facility that has been commissioned in Kolpong is something that I am very, very excited and happy about. And I think the people of Kolpong and those residents around communities around Kolpong are also very much excited about. This facility would serve as a health center facility and not a district hospital or a polyclinic. In that sense, we wouldn't be able to do admissions, but we'll be able to detain cases for some few hours and thereafter discharge them or refer them to higher facilities. In fact, the district does not have a hospital nor a polyclinic. And one of the major challenges we face is emergency obstetric and newborn care. Primarily because if you have to provide emergency obstetric and newborn care, one of the areas that you need to have at the facility is a theater to be able to provide cesarean section, and also a 24-hour blood bank to be able to provide blood transfusion services. But as a district, we do not have any of our facilities that is capable of providing these services. And so most of our cases are referred to the regional capital, which is some hours away from the district capital, as well as communities within the enclave of Kolpong.
You said that if the cases, you can do only basically OPD type of cases, and then anything that's beyond that, you'll have to do a referral. What's the closest referral hospital?
So the closest referral hospital is the Wa Municipal Hospital, which is located in the regional capital, or the Upper West Regional Hospital, which is located in the regional capital. Now, in terms of our drive from the district capital is about 3 hours.
Okay.
That is the closest to that route. Majority of the communities within the district are hard-to-reach communities. Hard-to-reach in the sense that during the rainy season, most of these communities are cut off. We have about 153 communities in the district. 53 of them are hard-to-reach. They are either cut off by bad road network or streams, rivers. And so when there are cases coming from these places, the best they can do is to refer to our biggest facilities, which is the health centers that cannot provide admission services and emergency care services, especially for pregnant women and newborns.
Now, what's the plan for staffing the new facility? Because our reporter was talking about the fact that a lot of the times when people are posted to the district, many of them either come for a brief period and leave, or they don't come at all because of the difficult challenges in terms of accessing, certain basic life amenities, as it were, for themselves.
Exactly. So within the regional health directorate level, there is a policy in terms of distribution of staff to the district. And so we are usually prioritized as a deprived district when there are new staff coming in. But the problem we face is when they do post them, they don't come. Those who come within 2 months or 3 months request to leave again. And even if their requests are not granted, they somehow find their way out of the district and even out of the region. Because this facility is a health center, there wouldn't be so much challenge in resourcing it with human resource. We already have a chief compound in that area. And so what we just need to do is reshuffle a few of the critical staff that will be needed to manage the health center there, and we'll be good to go. But our main concern and challenge is having a primary facility within the district that can provide emergency obstetric and newborn care, i.e. having a theater facility in any of the health centers, which we probably can upgrade to a polyclinic so that we can provide these emergency obstetric and newborn services over there.
I wanted to just find out quickly before you leave us. You've been with the Ghana Health Service for a while, haven't you?
Exactly.
What's the setup like? I mean, for you to be in WA East, are there any incentives because you are a more deprived area as a staff of Ghana Health Service? Are there extra incentives or perks as you, instead of being in let's say the capital or let's say Kumasi or any other more bustling region? Are there any perks considering the fact that you are classified as a more deprived area?
Yeah, exactly. So there have been tables on the drawing board for some time now with respect to staff that agree to work in deprived areas like my district. One of the issues that have been on the drawing board for quite some time now is the issue of having to promote staff who accept postings to these deprived areas in less period as compared to their peers that they join the service with. Thankfully, this year that has come to fruition, and so if you are posted to a place like WA East, your first promotion will take effect after 2 years compared to your colleagues that will be promoted after 3 years. There are others that have been tabled before higher leaders, and they are in deliberation on that. We're hoping that more of these incentives will be approved so that we will get more and more people accepting posting to deprived areas like WA East District.
All right, fantastic. Thank you, Dr. Kingsley Pascal Mwin. Dr. Kingsley is the Director of Health for the National Ghana Health Service with the WA East District. So, I think that the way when we began, before we spoke with him, what we're talking about is this whole thing of make it fair. Let it be a fair playing field, so that if you're in Accra, the standard arrangements are there. Anybody who goes into an area that is classified as a deprived area, there has to be perks, so that now it incentivizes people to say, listen, here I am, I finished medical school or nursing training, I'm 28 years old. Listen, for the next 3-4 years, let me go into a certain area because I'm going to get more money, I'm going to be promoted faster along the career path. So many different perks so that it makes it easier.
Yeah, so the doctor mentioned that there are certain incentives, you know, to people like that. But for me, if people are still rejecting, it means that the approach is
the
wrong.
incentives are actually
right?
new. They are
So even apart from that, you
yet.
are giving people incentives, but there should be certain basics in place. So if you're giving me huge sums of money, but the road network is extremely terrible. So yes, I have a car, but then when it rains, I'm cut off. You know, then what's the point? So you have the money when you're not even well, when your family is, any of your family members kind of not well, there's no way you can transport them to a nearest hospital. These are some of the things that we need to be looking at. So you can't give people incentives in isolation.
I mean, it should be piecemeal.
Exactly. So you can't just look at that and leave the rest. You know, what is education like in these areas? So if I'm deciding to move from Accra to go to, say, Upper West, am I going to get fantastic schools like somebody in Accra would have access to? I think these are some of the things that some people will go there and then they will leave. Because you realize that you're not getting the quality of life you probably were getting when you were somewhere else.
No, but I mean, the reality is that there will always be areas that you will not get the same amenities everywhere.
Absolutely, I agree.
So then,
but basics must be there.
So for example, you know, there are places in Africa where and I like to use this because I worked briefly with the UN, so I had a certain understanding of how the system works. But there are places where you can't even bring your family, right? It's accepted. But then but they compensate you for that by making sure that there are certain facilities that are available to your family in terms of payments for your children, for school, for this, for that. It's taken care of. Extra salary increases because of these kind of things. And also a faster promotion along the career path. You know, so
it's fantastic. Now, even here in Accra, we don't have the whole of Accra, you know, being the same. It can never be even. But my concern is when you live in an area where you wake up one day and the bridge has collapsed. you are completely cut off. You know, these are some of the things I'm talking about. I mean, the basics should be there. I'm not saying that maybe Upper West should be like Greater Accra region, should be like Ashanti region. No, but at least make it a bit bearable to the people who decide to go there, especially somebody who has been born and bred in maybe Kumasi, in Takrade, and then you are posted to an area and you wake up one day.
You can't go anywhere because the road is cut off.